Hi, I'm Dr. Sunil Richardson. I'm standing in front of Richardson's here in Tamil Nadu, Nagarkoil. So this is our building here. So we have a few floors. The basement is for parking. We can also park a couple of cars in front. We have some billboards in front. And then the topmost floor is the cafeteria. We have an auditorium and an office. And then the floor beneath that is fully operating theater. We have 2 OTs, ICU. And then the first floor is where the patient stays. So we have an entry on this side. You can also go down parking and you can take the lift and go up. So because this is lockdown, we're able to do this. We are not having any patients and I'm not having any work. So we're gonna take this video and show you around. So as you come in, if you come by walk, then you can take the stairs up, or you can take the stairs down. And that's the lift you can take. And we have a big lift because we can get the patient down if we need to. And this lift takes us to the floor above, the 3 floors above and 1 beneath. The one beneath is for parking and the one above is for the patient rooms. And then there's the OT complex with the ICU. And the one above, which I already mentioned, was the cafeteria and auditorium. So this is the waiting area. And then I'm going to show you our reception. And that's the reception here. She sits in there normally. And then we have a room. It says photography room, but this is locked now. So I'm going to show you my OPD. So this is where I sit and see most of the patients. Come on over, and I'm going to show you 2 of my favorite certificates that I've put out here. That one's from Stanford, and this is from Yale. And one of my favorite paintings, some of the other certificates. I sit here. We tend to see the patients here if they come one, and sometimes I can move on to the dental side, so I can sit and also have a look through this glass, what's being done there by my assistant, sometimes the orthodontist, the dentist, or the other doctors and the surgeons. We can also go like this. So this is the dental cubicle. And 2 of the dentists, the orthodontists and others work here. Sometimes also come into the suture removals here. We also have another treatment room for that. On that side, we have the medical lab. We're going to go out like this. Okay. Yeah, we have a small waiting. This is one of my favorite antique bench. It's an original antique, yeah. And then this is another room where we call this a treatment room. And we also use it for taking some short videos and pictures. So this is where the patient is put for some suture removal, small procedures. We can do treatments. I tend to sit here sometimes and take videos with all the certificates on the background. Sorry. And then we have our OPG cone beam CT scan rooms. So this one is the cone beam CT scan that has the large volume, covers a full face, length and breadth. And then this one is the OPG orthopanomograph and lateral cephalogram. Everything gets incorporated into this system here. Then from there it goes on to different computer outlets at my OPD, the dentist OPD, in the OR OPD and ICU and everywhere from there. All right, and then we have a small medical lab here. I'm going to check if this is open. So it's not open. That's because the staff is locked. We're just trying to see what else we can do. We'll probably go on the lift now to the first floor. Okay. Come. So we're going to go to the second floor first. I'm going to show you some of the patient rooms. We have 4 suites that are with air condition, and there's one nice suite. I hope the rooms are open, though I'm not sure if it's going to be. And then we have some non-air conditioned suites as well.
Second floor.
Yeah, so that's the second floor. Okay, so we have some place here. I'm going to turn on some of the lights. So as you see, it's all empty now. This is almost 1 month after the lockdown. We've rescheduled all our elective patients into the month of May. And most of my work, like almost 90% of my work, is elective. and so we didn't do any work. So this is the place where our nurses sit up, and we have these rooms, all of them are locked, and this is a suite which has, and then this is like a ward. It's a small place, but we have 8 rooms in here, and this is AC1, that's AC2, the 3 AC rooms here, and then the other 4 non-ACs, 5. And so some of these rooms are a little large and some are not that. So we sometimes can put 2 patients when we have too many patients in our clinic, in the hospital. So it's a 21-odd bedded hospital in all. Now we go on to the next floor. That's the OT complex. We have the OR. Yeah, and this is the 4th floor. So this is where we have a small pantry. Again, this is locked. Auditorium. It's a small place, but we can have our talks here. We can seat about 25 people, sometimes even 30. So it's nice for our educational programs. We sometimes have our meetings. We have our videos that can be brought in directly from the OR, or we can also have our small meetings of the hospital with our staff members. All right, and then we have, this is the office. Again, that's closed, and there's another room here which is closed. This is like going to be a cosmetic setup room with laser and everything. That's the office, that's closed. Okay, so let's go down to the 3rd floor now. I hope it's open. So our 3rd floor is the floor that has the OR. We have 2 operating theaters, 1 ICU with 3 beds, a pre-anesthesia room, surgeon's room, a nurse's room, a sterilization room, a store, and an autoclave. So that's in this floor now. Oh yeah, so everything is locked. So this is because we haven't scheduled any cases. You see, it's shut, it's locked. And we also are in this lockdown, and we're really waiting eagerly for this lockdown to end, and so we can resume back to what we really love to do, take care of patients who have issues with the face. So many of our patients are now waiting because we haven't done any elective work from the 22nd of March, and this is already 18th of April, and then we have this lockdown till the 3rd of May. So we've already rescheduled a lot of our patients that have called us into the month of May, and I'm really eager to come back and start working. I think this is the longest period ever where I haven't operated since I've got my training done, I guess. It's also the longest period where I'm in one place, stuck or put up like in Nagarcoil. Thank you.